Morning viewers. Hello, ladies. How are you? Morning viewers. Welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo in partnership with AIT. We thank you all for joining us this morning. And today, what we're talking about the hope for tomorrow, challenges and progress in childhood cancers care in Nigeria. So, welcome back. Together we fight, together we win. Just to quickly remind you that the August giveaway is still on, and we will announce the host before the end of the week. And it's open to anybody who has cancer and is in active treatment. So let's start this conversation very quickly. Who is our guest? Our guest is Dr. Ozzy. And Dr. Ozzy, good morning.
Good morning, Dennis, and thank you for having me.
You're welcome. Dr. Ozzy is the head of management of Okapi Children Cancer Foundation, head of management, a public health gosh, I can't say this word. A passionate advocate. Let me just leave it. A public health and passionate advocate about childhood cancers, and committed to raising community awareness about childhood cancers. His expertise is community mobilization and communication has greatly impacted on the public sensitization on childhood cancers. And this has led to an increased access to care for children with cancer. So we're going to start this conversation. Thank you all for joining us. Let's remain united against cancer, as together we fight, together we win. What's our first question? And I'm going to ask you just a few questions and very short answers, please. What are the most common types of childhood cancers in Nigeria?
Okay, thank you so much. One of the commonest cancers we found in Nigeria, especially with the Abuja experience, is retinoblastoma. It's becoming very common amongst children now. Another common cancers in children is lymphoma, and then we also have nephroblastoma. Those are the three common cancers we have currently in Nigeria. But there's brain tumors and others, but these are the three common ones.
Oh, wow. Some of those words are very complex, so there's no way I'm going to help you to repronounce them. So let's go. So can you describe the current state of childhood cancer diagnosis and treatments in Nigeria?
I would say the state of children cancer diagnosis in Nigeria, it's a little bit appalling because we have a lot of misdiagnosis amongst children. In the same vein, because of late presentation, even when diagnosis is apt, you find that management becomes very poor. So diagnosis is a little bit challenging. One, because of the navigation that these children have to go through to get to care. Oftentimes, they start from, the wrong basis. For instance, they may go to a chemist. From chemists, they may progress to a primary healthcare center where the appropriate diagnosis may not be made. By the time they land in the tertiary healthcare center where appropriate and concise diagnosis may be made, the disease would have progressed so far that it will now be difficult for management to take place effectively. So in a nutshell, diagnosis is not very good currently in this country.
I'm glad you said that. I think a lot of times we talk about cancer and we talk about it more in adults. But it's interesting to know that even in children, a persistent illness, I think this is a message I keep saying, maybe because that's what happened to me. A persistent illness requires urgent care. I say this thing every time. And viewers, please, a persistent illness requires, a doctor has just said, by the time we go through the process, you've gone from one to the other, we are now getting to late diagnosis. Please. That is one key thing I've picked up already. Thank you very much, Doc. What's the biggest challenge that patients... Okay, you've answered that for me. So now, the next one I'm going to ask you is, what role does socio-economic factors play in the outcomes for children diagnosed with cancer in Nigeria? And how are these challenges being addressed nationally?
Socioeconomic factors play a predominant role because a combination of two factors there. You're talking about the social interactions in the community and then the economic indices that drive access to care. These are the main determinant of care. One, when you're talking about socioeconomic indices, you probably will not be able to rule out the role of culture and tradition, in providing care to these children. Oftentimes, because of the social dynamics that we have, we always have this mentality of either it is not my portion or this is the will of God. So care is not, is not initiated, early enough. And so this eventually will lead to the outcome. And then, of course, we cannot talk about economics without, realizing the impact it is having on the care for this patient. We know currently that the cost of care for children with cancer is astronomical, and oftentimes is out of the reach of the average family. And we have seen cases where children who perhaps would have survived on the account of the care that is available, they may be living right next to the hospital, but because they cannot afford to pay for the services, we may find a situation where by the time they manage to pull a few resources together, management becomes difficult, and who knows what will happen in most instances of those type of patients.
Wow. Now, when we look at what are the common, so this was just a quick one that's just come up because we were talking about childhood cancer. Can you give me like the top 5 common things that would be found if a child that would make you know that maybe there is an alarm bell ringing?
Thank you so much, Dr. Denny, for that question. Now, persistent fever that does not seem to resolve, it's one indication that there is danger, and that child will require more intensive care. Secondly, if a child keeps complaining of headaches, for a very long time, even with the intake of normal painkillers, please send that child for more evaluation. If you notice bone pain, if a child is always complaining that there's pain in the bone, if he can even get to the point of describing that process for you, then it means that it has really gone bad. Because sometimes these children are quite young. They probably will not be able to localize the pain or describe it in concise terms. We may have some challenges. So if a child has bone pain, that's also a red flag. Now, if we have swelling anywhere that does not seem to, you cannot explain, please send that child for more evaluation. And if a child easily cannot stop bleeding or bleeds very easily or easily sustains injuries that does not seem to heal fast, that is also a red flag for that child to be properly evaluated, for the presence or absence of cancer. And then these are not they're not definite diagnoses. That a child has persistent headache doesn't mean that child has cancer. But it's always good to evaluate so that you can rule out, the presence of cancer in that child, especially when they are between the ages of 0 and 19.
Thank you. You throw me when you say that, because actually I was diagnosed with cancer, but it was from headaches. And a lot of people don't realize that headaches are quite in very many illnesses. We take it as an everyday, I have a headache, and we just don't realize. Oh, wow. Okay. I'm going to ask you now one particular question as I start to round up, and that's to do with Okapi Cancer Foundation. And it's a childhood cancer fund NGO based in Abuja. So this year you will be having activities, I presume, as we start to prepare, because I intend that we will talk a lot about childhood cancers this September as we go into Childhood Cancer Month. So you are starting this conversation. Please share with us, what are your plans, or what is Okapi plans for children this September coming? Because I think I would like to do some fun.
That's good. That's very encouraging. Now, for September, and precisely on the 28th of September, Okapi Children Cancer Foundation will be having its 8th annual walk. This walk is a sensitization effort to continue to raise the bar in terms of creating awareness about childhood cancers in Nigeria. And currently, we are having this event in Abuja as our 8th edition. Every year, we normally do this to raise awareness. And oftentimes, we get participants from about, people participate to the numbers of, over 2,000 people come on board. For us alone, that we have 2,000 persons talk about cancer, it's a huge deal, to raise the consciousness of people about childhood cancer. Because we know that oftentimes childhood cancer is relegated to the background. We talk about cervical cancer, breast cancer, and every other cancer, but you don't find anybody discussing issues about childhood cancer. So September, we'll be talking again to the general public about childhood cancer in Nigeria. And that event is going to take place at Jabi Lake Mall as a takeoff point, and we'll be running through about 6 kilometers, sensitizing the public, talking about childhood cancers generally. 28th of September is the date that we have in mind for that event. I will invite everybody to come and please play their part in generating awareness about childhood cancers in Nigeria.
And you'll be having some fun fair, and you'll be having some things that make the children celebrate, because I'm a teacher, so anything that children must enjoy is okay with me. Enjoyment is standard. No matter whether the cancer is cancer, enjoyment must standard. Jay, you guys are ready for the enjoyment?
Yeah, we are ready. And just to quickly add, we don't just do enjoyment, we also provide medical care on that day.
That was the last one I was about to say. I hope you are going to do medical.
Oh, yeah, we are doing some screening as well, for everybody, both children and adults, just to be able to catch some of them, early in the course of the disease.
Oh, wow. Thank you. And as I'm rounding off now, can you give me just one thing a parent needs to know to make sure that they are on top of their game? I mean, financially, things are not easy in the country as of now. So one thing as I close that parents need to do, because I'm more interested in the children now, this conversation is about children, that we need to do to make sure that the children have fun irrespective of the diagnosis. What would you like us to see? For me, when I say it for adults, I say well-being. For adults, the well-being of a cancer patient is very important, and I look at it from my perspective. But I didn't get cancer as a child. What would make a child happy and to be engaging with the treatment, because it's very difficult. I'm sitting on this chair as an adult, so I know.
I think the first thing that I would say is that the parent themselves should be excited to take that child for care. Because when you wear a gloomy face all the time in managing a child for cancer, you are invariably telling that child that, look, there's literally no hope. So the first person is the parent who is taking that child for care. Then secondly, every effort should be made to allow that child have the best of life. If that child had a dream, always put that dream before that child. And let me just quickly drive home the point in this course. Every Children's Day in this country, and as far as we're concerned in Abuja, we gather these children together and throw a party for them. And then again, at the end of the year in December, we also throw a party for them because we believe that they should not be left out of celebrations. So we always bring them together and organize an event where they have gifts, they have, goodie bags, they have fun, they have, mascots, they have everybody celebrating with them, just to make them feel that they are still part of the community. That they are receiving care does not mean they should be excluded from celebrating Children's Day and Christmas.
Now I'm going to advertise on behalf of all of us, Kakasi Cancer and myself, Comfort Cancer, and all cancer foundations across the country. We are appealing to all of you out there, please engage with any childhood cancer foundation across Nigeria and help us help children. Make this journey not as bad as it is. Kakaki is supporting this program in its totality. So please, can we ask you, all of you across Nigeria and in Abuja, please go to on the 28th is Jabi Lake. I think in Lagos we have something else going, and anywhere else in Nigeria, please engage with the children. I am appealing to you on behalf of all of us who actually drive this program. So I want to say a very big thank you to you, Doc, for joining me today, and I will be coming back to you because I think it would be nice to talk to a child who has gone through the lived experience as a tool to help to engage other people. And we look forward to seeing you all again soon. Follow us on all our social media handles. You can find us Common Cancer Foundation. We've got the Instagram, Facebook, or anyway, just look for the name, you will find it. I'm so tired of really calling it out now. You will find everything that's going on our spaces. And next month is Childhood Cancer Month. So please, can we all engage with it? And we will see you again very soon. Have a fantastic week. Please, those of you that are on the giveaway is still on. September's own. August, I think, is about to go. September is about to start. Make sure you are in. If you are in, you win. Have a lovely time, Doc.
Thank you so much.
All right, doctor and doctor there, both doctors discussing health matters and how to help children, particularly those who've got cancer. The care is important, the challenges there are, and of course, how we can progress in this regard.
Our message is very clear. Together we'll fight, together we win.